One thing that's really important, something that I kind of had to learn. So when I started powerlifting, there wasn't as much information out there. Okay, the internet still did exist, but there wasn't as much information out there. Instagram wasn't a thing and all that. So we were always taught arch, 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 arch. And I'm sure maybe you hear like chest up. And sometimes I may even use that cue, but cues are just cues. Cues are just to kind of get you to a certain thing. But so sometimes, so for example, if I said chest up to Emily versus chest up to Joe, it's going to be a way different result. Okay? So I want you to kind of feel where your ribs are. I want you to feel where your kind of pelvis is. And understand that there's a relationship between your rib cage and your pelvis. And you can move one independently from the other. So if I move my spine, my rib cage is going to move. If I move my pelvis, my spine's also going to move. So like there's a relationship there. And in general, you want a stacked position between your rib cage and your pelvis. So has anyone ever heard of like anterior pelvic tilt or posterior pelvic tilt? So anterior pelvic tilt basically means that there's an arch in your low back. And everyone is going to have some sort of lordotic. There's going to have some sort of curve in their low back. And at a resting position, and you're going to have some sort of kyphosis or rounding in your upper back. That's natural, okay? So when we say neutral spine, you're going to have maybe a slight arch in your low back and a slight rounding in your upper back. That's fine. But we want to try and get it as neutral as possible. So one of my rib cages stacked over my pelvis. I'm going to have 3 points of contact with my head, my upper back, and my butt. Okay. So if I'm going through like a hinge position, for example, or a squat, whatever I'm doing, I want to move at my hips independent from my spine. If I move at my spine, I lose contact. If I move at my spine, I don't really have a lot of extension, but I'm going to lose contact here. Okay, so overextension is not good either. Rounding is not good either. We want to try and stay as neutral as possible. We also don't really want the spine position to change as well as we're going. So in general, we want the rib cage stacked over the pelvis. We're going to work on breathing and bracing in a little bit, but I just want you to kind of just understand. So I want you to work. So this is a posterior tilt. This is an anterior tilt. When I do the anterior tilt, what happened to my ribs? Okay, so now my ribs are pointing this way, pelvis is pointing this way. So we call that open scissor position. That's like a closed scissor. Now my ribs are pointing down, pelvis is pointing up. Visual of it. So I just think, you always want them pointing in the same direction. In general. What's the one exception? Bench press, because your spine is not directly loaded. So having a little bit of global extension there. Now that being said, I still don't want to excessively arch my back. I want most of my range of motion to come from my hip and my upper back. There's kind of 3 kind of master cues that or 3 like main kind of things that we always talk about. In the bench squat and the deadlift, we want to breathe and brace. We want to root the feet, and we want to break the bar. And the combination of those 3 things create a lot of stability. And we're going to kind of go back to mobility later with Emily. So we're going to focus primarily on stability right now. All the muscles in our diaphragm and our core. Can I have that princess ball?
Which one?
The pink ball. I figured that was, yeah. Okay. Nice. Okay, so now, how do I hold this position? Use a combination of your breath and your brace. So pretend this is my diaphragm. It's not. But when I expand it, what happens? In how many directions?
2.
We're going to say 3. But obviously you could argue it's an infinite amount of directions, right? So front, sides, back. What do most people, people use the cue, like push your belly into the belt, right? So if I only push it forward, a lot of times you get that overextended position. So I like to think about drawing down. So if you could imagine when you're setting your breath, imagine this is what's happening to your diaphragm in your belly. It's compressing. So now this is coming out, this is coming out, this is coming out. And we're going to go through drills like that. So that's kind of like a visual representation. Complex, and how do we make this more specific? We add movement. So like I mentioned before, we want the ribcage stacked over the pelvis. We want to be able to move the hips independent from the spine. So we're going to go through a dead bug progression and a leg lowering progression. The dead bug progression is going to mimic more of a squat position. So if I could imagine, relax your head. If I could turn them upright, that would look like a squat. If I could turn them upright, that would look like a straight leg deadlift, right? So squat pattern, deadlift pattern. So I'm going to go through squat pattern first. I'm going to go through. Can you see if there's any green or yellow bands in that tray, please? They're like really short, so they perform better on them. Excellent.
So close.
I really made a big effort too. That's why I wrestled. I didn't play basketball. Okay. If I want to make it more specific, I can kind of adjust his stance width a little bit, but in general, if you have the knee and hip aligned, that's fine. Dorsiflexed, that's going to be a more specific position as well. If I want to make it harder, this would be for any variation, I could reach, do it with a reach. If I want to start someone out, just can have him be here, and then he could actually put his palms down so you can get a little lat tension as well. So I'm actively extending the shoulder. It just depends. So like I do a lot of myself with a reach, so I'm just getting a little bit more core. I'm going to have him set his breathing and his brace first, and we're going to start off with just a heel tap. So I want you to push into my finger here, push into my finger. So we're just trying to hold this static, and I'm going to come down slow. Just miss the ground, hold, and then back in. So that's level 1 because it's a shorter lever. Level 2, we're going to extend this straight out. So again, push into my finger, extend straight out, kick out, keep going. Now start to lower it, start to lower, start to lower, hold, and back in slow, 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 slow. Okay, so you're losing a little tension here. So what I don't want to see is as you extend out, I don't want to see this move at all. So this should stay above parallel. Level 3, I can give him some manual resistance. So I'm going to give you a little bit more pressure now. And extend out with this one. Pushing my hand harder. And up. So I'm actually trying to shove him out of position. If you're doing this by himself, so let's just do this on the other side just so you're not frying one hip flexor. Set your core. So we're going to kick this leg out. You're going to push this leg forward. Feel that?
Yep.
So this is trying to pull him forward and then back in. Lost it. Feel that?
Yeah.
Let's do one more. Try and keep. So we could do the active straight leg raise. We could just do that assessment. We could just kind of practice. Come up. Straight leg. Okay. Level 1, I could use both legs up. We could use a band or, oh, that band is snapped. I can use a different one. So I'm just going to be like a wall here. So we use a wall or so leg straight. Good. Come up a little wider. Down slow. Slow, slow, slow. Hold. Back in. Back in. Hold. Good. If you don't have a wall, or I'd still say this is still like a, just because you're not using an immovable object anymore, I would still consider this like a level 2. Both legs up. But we're going to use a band, a towel, a belt, whatever you have access to. Pull the band so you can do like a little row. Chest up. So you're going to start in a position where you can keep the knee relatively straight. Good. Set your core. Go, move slow. Back up. And relax. Last level, so we'll just do the other side. So I'm going to keep here, knee straight. We'll move this one down now. Relax the neck. So you can see he's shaking, he's having like a little harder time with this one.
This is my back.
You feel your back?
Yeah.
Yeah, so this would be really helpful to help improve your deadlift stability. So this might be too advanced right now, you'd probably stay with the band.
Yeah.
Okay, great. And you guys see on the third one, it was he's starting to use his neck, his shoulders coming forward, so he's trying to get stability from other places. So, but this would be a really good like pre-deadlift or pre-squat warm-up.